Dr. David Levens, certified by the American Board of Plastic Surgery, is considered one of South Florida's finest plastic surgeons with 30 years of experience. As a privilege of aging, you pay for that with wrinkles, sagging, and wrinkles in your skin. Modern plastic surgery procedures allow you to look better and feel better about yourself. His office is located in Coral Springs and serves patients from all of South Florida and beyond. When people are taking care of their health through diet and exercise, yet are still unhappy with their appearance, a consultation with Dr. Levens can address both facial and body concerns. Through various sculpting procedures, you can improve your appearance from head to toe. If you are considering plastic surgery, you should do your homework to carefully research your choice of surgeons. While the majority of plastic surgery patients are women, plenty of men take advantage of various offerings, and Dr. Levens has a lot of experience with male-specific procedures for the face and body. Contact Dr. David Levens' office today for a free consultation at 954-752-1020. That's 954-752-1020.
You are listening to the Ask the Expert Show with host Steve-O. We will be right back with more experts in the field of legal, health, financial, and home improvement. Join us every Thursday from 5 to 6 p.m. Now, get ready for more Ask the Experts.
And we are live. I'm Rhonda Hines, and tonight we're joined by Dr. David Levens, our resident expert in plastic surgery. A little bit unusual connection tonight, right, Dr. Levens? We're both joined, by phone.
It certainly is.
Coming from our living room.
I enjoy seeing you in person.
Yeah, I miss seeing you guys as well. It's definitely different. I definitely miss human contact. That's for sure. I'm definitely a people person. Need to be around others.
For sure.
How about you? Sure. How are you faring?
Well, fortunately, I'm doing well, and my family, and everyone is healthy and doing all the appropriate things. Our closest person to the front line, so to speak, is my son, actually, who's a resident in orthopedic surgery in New York at one of the busiest teaching hospitals. So he's being pretty much taking care of medical patients because there's really not much elective surgery and orthopedics going on. Everything's focused on the COVID-19. But fortunately, he's doing well. He has a girlfriend who's taking good care of him. He's got all the equipment he needs, all the PPE, and we stay close in touch. We actually did a nice Instagram Live just the middle of last week. So everyone really enjoyed seeing, what it was like from the front lines, and we enjoyed seeing him. So all is well.
So he's actually
we're
treating COVID-19 patients?
What's that?
So he's actually treating COVID-19 patients?
Right. So what happens is, with a house staff physician, they're pretty much at the mercy of the hospital. And as an orthopedic surgery resident, he would not be necessarily taking directly care of patients with COVID-19. Of course, however, there could be people that are asymptomatic and whatnot that break their hip or something like that. So when it comes to elective procedures like an ankle injury that, can wait to be fixed, or a hip that can be wait to be fixed, the hospitals have been pretty much not allowed to do routine elective surgery because they didn't want to use up the resources that would be necessary for the high quantity of COVID patients. So what's happening is that he is working on the medical floor. So that he is actually, yes, working directly with COVID-19 patients. Fortunately, they're not necessarily the sickest ones. He's not in the ICU. He's on a regular floor for patients that, are being monitored, treated, and hopefully mostly getting better. I mean, some of them deteriorate and go to the ICU, but that's where he is. Yeah.
Yeah. Well, God bless him. So
thank you.
Luckily,
he's
staying healthy.
We've been giving him a lot of pride and prayers on our side. And as far as my side, if you want to know what's happening, we're pretty much closed down. Clearly, you guys, you're not doing studio work anymore, and we are not in the office.
Well,
because
some people, Steve goes into the studio, I think, and Ken's there, of course, manning the station, the one-man show.
Oh, okay, but
for
you're
the
not
most
having
part,
guests come in.
Yeah, for the most part,
it
has slowed up a little bit. They've, limited the number of people going in to take precautions,
right?
And, keep everyone healthy.
Well, that's what we're going to do when we get back to work, which, we haven't for a month, basically. I've seen a few patients selectively a patient that has a problem that I operated on that needs to be looked at in the office. We wear a mask, we wipe everything down, be careful, not too many people at once, and just taking all the precautions, which is exactly what's going to have to happen. Once we open up and we get into this phase one of the 3 phases, each state, each city is going to be different. But I'm hopeful it's going to happen sometime in May around here, and maybe we can, on a limited basis, get back and still cautiously examine patients, treat patients, and start getting back to doing procedures and surgery, which is what I really want to do.
Well, you know what some people are thinking right now? Boy, I wish I went in for that last injection of Botox before all this hit, right?
Exactly, and now it's wasted. Well, then there are other people that are saying, what's the point? Because they're asking me about coming in for injections now, and I say, I really shouldn't. It's not really appropriate. And the truth is that they're not going to have to see anyone anyway, except that they're doing a lot of FaceTime. So they do appear on FaceTime, and everyone gets a chance to shower and put on some makeup, and then they can just wear shorts or whatever. It doesn't matter because all you can see is their face. But the other thing about FaceTime is really interesting. This is something that when you look at someone looking at on FaceTime, whatever, whether the camera is above them or below them, the worst place for the camera is below you because then you have a really bad view of your face and your neck and everything like that. So always remember to look up at the camera. Definitely looks better.
What's unfortunate about this is most people have a lot of downtime. So this would be perfect time for people who want to do a facelift or some other procedure where, there'd be downtime. It's just, no one's doing the procedures right now.
You're absolutely right. It's kind of like the last time we spoke, it was right after we had flown, and we were talking about airfare. Air travel was so down that it'd be a good time to fly, and it would be a good time to recover from a procedure. But the problem is being able to do it safely and not, getting cited for doing something that's considered quote unquote non-essential. So, whatever. It's not easy to take that you're not essential.
Sorry, I didn't mean to cut you off.
That's right.
You mentioned some of the different phases, and then you said you thought possibly in May people would be back up and running. Do you think that's early May, mid-May? What's your thoughts?
Well, I really, like from the start, I'm certainly not a healthcare policy expert or anything, but I'm paying really close attention to, the president and the orders and the whole business. And they, as a few days ago, they started talking about because the worst place right now is New York, and it's peaked and it's starting to go down. I think that what's going to happen is, unfortunately, Florida is probably going to be a little bit farther along in terms of the peak. Although, it's really interesting because certain areas, like the fact that Jacksonville, which must have very few cases, they decide to open up beaches and, they're trying to slowly do things. I think here in South Florida, we probably have a little bit higher rates than up there, but definitely not anywhere near what's happening in New York. So as far as overwhelming the healthcare resources here, I don't think it's likely to happen unless we really sort of screw up and stop all the distancing. But my point was that
plateaued here?
Well, they're talking about I don't know. I don't think we've plateaued here in Florida, but they're talking about the way they have it all organized. It's phase 1, phase 2, phase 3, and the phase 1 is that supposedly a certain area has had 2 weeks of relatively low cases, decreasing cases, stuff like that, and then at that point, they're going to decide that certain businesses will reopen that are considered, almost essential, not the ones that have stayed open, which are hospitals, police, first responders.
Construction.
And then each of those places are going to have to do their own thing, like your radio station, for example. They're already doing it, using a mask, not shaking hands, right? Trying to keep some distance, and then keeping the volume down. So you're not going to have 10 people parading back and forth. You have to keep the numbers down, and that's it. That's what it's all about until the testing can be ramped up, and that's the whole idea, because that's really all, what we're going to have to know eventually is, who's positive, who's got immunity, who's this, who's that. So it's a long process, and I'm just as anxious to get back as everyone else, believe me.
Yeah, and you may not know the answer to this, but what are they using? I've heard different things of what they're using for testing. I've heard they're using actually basically a lab equipment that basically amplifies DNA, and it is not a true virus test. Have you heard that? That what they're using to indicate
once again,
whether you have
I don't
COVID-19
know.
is
I think
not
generically,
a true test for a virus.
I think categorically there are basically 2 things that are being done. One is testing for the presence of the virus, through those swabs, like that they can see that this is that virus. And I believe that for the test, the good tests, there's some, tests that it's question whether they're accurate or not accurate. For the accurate tests, I think those are pretty darn accurate. The next type of testing is looking for the antibodies in your blood. So what that is they're looking to see, have you had the virus, meaning that you have now made antibodies to it. And that's the really confusing thing because, how many antibodies did you make? How good are they? And how long is your immunity going to last? That's what I think. It's clear to me that this is going to be like a flu type of thing, that it's going to be probably seasonal. So it could well come back again, next fall or whatever it is. But hopefully by then, a little bit more what's called herd immunity, which means that so many of us have been exposed and have gotten it and are okay that we're not going to pass it on as much, and we're going to be okay. And then getting a vaccine. I mean, that's going to be the answer. It's going to be like every year. I don't know if you do it. Actually, we had a vaccine discussion once, but I typically do get the flu vaccine. But once again, there's absolutely no guarantee that you won't still get the flu, although it does decrease the chance. And it's going to be the same thing probably with this, COVID-19, that there will be a vaccine that, most people will probably choose to get. And just as far as the mortality is concerned, I think we talked about this, that the seasonal flu does have huge, huge numbers, but the mortality is only like 0.1% of people, whereas this can be as high as 1% or even 2% of people that get this. So it's like potentially 10 times more lethal. That's why, it's definitely, frightening. It's just, fortunately, it's the numbers are, look, there's 40,000 people that died in the United States. Whatever. It's a fraction of what die every year anyway, but it's still a pretty scary big number. So, but it's keeping, I think it's the good thing, this whole distancing and the whole flattening the curve, it's definitely keeping them. At one point they were talking about numbers that are much higher than that. So I suspect it's not going to go that much higher, whether it's going to be 50,000 or 60,000. It's still every life is too many, but it's definitely hopefully going to stay on the lower side. So.
And
we're not
do you
talking
find
about
it's
plastic
still more
surgery
elderly
now.
and folks with other health conditions who are more affected?
It definitely seems to be more fatal and more lethal with people that have predisposing conditions. However, they've been very careful to say that don't assume that, just because you're young and healthy, and I know you're young and healthy, that we can't get it. I'm already getting old, but it's an interesting thing that the young people, what they say is that one of the reasons why young people, that it's a young, healthy person, how could it be possible? Well, it might be that their immunity is not weak, but so strong that they have a strong immune reaction. And there's something called cytokine storm, where basically you start pouring out all these inflammatory cells and they get into your lungs, and that's what, ends up causing all the breathing problems and can, lead to something bad. So it's like their immunity is too strong, which is interesting. So,
well, are there two different strains of the virus going around?
I think there's only one that I know of. Right now, but they do talk about the fact that there can be mutation. And that's a little bit frightening because, like, if they get a vaccine for the one that's out there now, could there be a mutation that all of a sudden they have to develop another one? But look, I think the experts are definitely working on that.
But couldn't it mutate into a way where it's not as harmful too? It could also be a positive mutation, correct?
Well, I'm sorry, what's that?
Could it also be a positive mutation where it mutates to not affect you so harshly?
Certainly, it's
possible?
a possibility. How about if you want to really spend your time reading things, you can read about how, like, the bats are resistant to it, because that's the theory, is that they do originally in bats, because apparently bats have some resistance to viruses, and that's what was supposedly infecting the animals in Wuhan, China, et cetera. There, of course, is that lab there, and that's some people, who knows what's true and what's not true, but certainly some conspiracy people are thinking that, whether they deliberately let it out or it got out accidentally or whatever. So who knows? Well,
hopefully one day we will know what happened,
Exactly. That's what's going to happen.
It does seem odd, though. We've had SARS, we've had other things, that this has happened on such a global scale at such, an interesting time of things going on with humanity and, elections and things. There's an interesting time for things to happen, and the fact that it has shut the whole world down. The fact that, I don't know, some people are saying the fact that Bill Gates is sponsoring the vaccine, that's kind of interesting. I've never, Microsoft guy getting involved with, vaccines. I could see why people might be questioning that.
But the thing about that is that, would you think that someone like that, unless he was really evil, I don't know if he's evil or not, who has $1 gazillion and can't even spend all the money in his lifetime without whatever, would need more money for some reason to develop a vaccine? Why would that be, right? Or in other words, what would be?
Maybe some boredom, right?
Yeah, I guess so.
He's just bored. Wants to hit a different area. Well, we're going to come back after this commercial break. When we come back, let's talk about how you are going to transition the office back to normal, what procedures you're going to start with, and then let's talk about
Sounds
some of
great.
the common procedures that you do.
Sounds great.
So we'll be back after this short commercial break with Dr. David Levens.
Dr. David Levens, certified by the American Board of Plastic Surgery, is considered one of South Florida's finest plastic surgeons with 30 years of experience. As a privilege of aging, you pay for that with wrinkles, sagging, and wrinkles in your skin. Modern plastic surgery procedures allow you to look better and feel better about yourself. His office is located in Coral Springs and serves patients from all of South Florida and beyond. When people are taking care of their health through diet and exercise, yet are still unhappy with their appearance, a consultation with Dr. Levens can address both facial and body concerns. Through various sculpting procedures, you can improve your appearance from head to toe. If you are considering plastic surgery, you should do your homework to carefully research your choice of surgeons. While the majority of plastic surgery patients are women, plenty of men take advantage of various offerings, and Dr. Levens has a lot of experience with male-specific procedures for the face and body. Contact Dr. David Levens' office today for a free consultation at 954-752-1020. That's 954-752-1020.
And we are back with Dr. David Levens, our expert plastic surgeon. And my apologies to our listeners out there if, I'm running over Dr. Levens when he speaks. It's a little bit hard to sometimes tell when you're calling from a cell phone. We usually can see each other in the studio, and, I can know when he's finishing his sentences. But Dr. Levens, we left off. We were going to talk about how you were going to start, increasing your business again and seeing patients, maybe, I guess, are you going to start doing surgeries right away? Or are you going to start with injections? What do you foresee?
Sure. That's a really good question. So what we have been doing is even before we get started, the interesting thing is, businesses that have been able to continue are still generating income. Our business is not generating income. So we definitely took advantage of all the small business loan things, and we got in touch with people, and we, spoke to our creditors and that kind of thing. So I think that's a good thing that at least, businesses, banks, et cetera, creditors are paying attention and trying to, put off payments and things like that. So that's one thing we did. And then as far as staying in touch with our patients, we've been doing virtual consultations. So we have a secure kind of FaceTime essentially through our electronic health record system where we're able to stay in touch with patients, which we were always able to do before. But now it's become very vital. And for a lot of doctors as well, I think that telemedicine is really going to take off from this whole thing now, which it's been in the background, but now it's definitely getting much bigger because it's a great way to be able to stay in touch with your doctor and patient and not have any threat of transmitting a virus. So we've been doing that. And then new patients that want to that contact our office, we've had consultations with them and talked about, their interests. And then we can share photographs and we can, do a video. And so that's been really good. And then we've been posting a lot on our social media outlets. So we have an Instagram page and a Facebook page with my name. And that's been a good way to stay in touch with people, just try to provide, sensible information about the virus. And then, at the same time, information about what we really want to do, which is, plastic surgery. So when we get back, which I don't know, I'm hopeful about mid-May or something like that. We'll have to see what's going on. But essentially, I think what we'll do is we'll very carefully screen patients in the office, probably take their temperature, although, that whole business about people can be asymptomatic and still have it. But just do the universal precautions, essentially use a mask, try to keep the distancing, keep the alcohol wipes, the Clorox wipes around, wipe down counters between patients, don't have a big volume of patients coming in. If we had 10 patients in a morning, we'll have only 5 patients in a morning so we can space them out in the waiting room. And then the types of procedures probably will start with injections. The funny thing about the injections, though, is I'll have a mask on, and I'll definitely have an N95, which is a really good mask. And if we can provide this for the patients, we will. But otherwise, they'll have basic, probably surgical masks. And if I have to do a lip injection, it's going to be difficult to do it through the mask. So if people want to have good lips, I guess if they're wearing masks, they don't have to worry about their lips. But like for the upper face, we can do Botox injections. So that's definitely a good thing because you can kind of get away from the mouth. And then And then we'll have to see. And then when we start doing surgeries, the surgery center where I do most of my procedures has to open it up to, more electives. So that's something that they're going to probably take a directive. But I do have a private office operating room that I share with another doctor. And I think because we're not under the auspices of, of the federal government and all that and state, that we can very carefully also do the same thing, because it's a single operating room. We operate on one person at a time, and they're basically 2 or 3 or 4 or 5 staff members. So really not a big group. And if we can very carefully do that and screen those patients, then we'll proceed. The other thing is that as far as the testing is concerned, there's all this talk about not being enough tests, around the whole country. I don't even know right now as a private practitioner how I will be able to get access to testing for patients. But clearly that would be the best thing to do, to have the test, like I said, for the presence of the virus, and then the test for the presence of the antibodies. I think that's going to be a while before that comes. So we're just going to have to, continue with precautions. And, we'll see. Look, I have some patients, just like you were mentioning before, that this seems like a great time to recover. You're out of work. It's 2 weeks to recover from surgery. I have some patients, many that said the same thing. And others that said, look, I have to, I don't have a job. I have to pay for food. I can't pay for cosmetic surgery. So it's kind of all over the board in terms of what's happening. But we get calls from people, and we say, look, we're going to get back to you as soon as we can and get started. And we do a lot of injectables in the office, so that would be Botox and fillers for facial rejuvenation for men and women, lines, wrinkles, folds. And then we do skincare treatment. I have an esthetician that does a full range of peels, laser, chemical, laser hair removal, microneedling, and all kinds of treatments for the skin. And then when it comes to surgical procedures, I tend to do those in the operating room with at least some degree of sedation. I do some minor procedures in the office with just local anesthesia. I'll do removal of some small things like moles and things like that. But as far as anything that's bigger, like a breast surgery or a tummy tuck or a liposuction, or breast lift, that type of surgery I would do in an operating room all the time.
So you offer free consults as well. So is that something you can do
and free virtual
online
consults
right now?
What's
with,
that?
With some clients? Is that something that you could do online with some of your clients now?
Oh, no, absolutely. So what we have on our website, is www.drlevens.com. We have a virtual form, and what happens is the patient fills out the information, the procedure they're interested in. They can submit photographs. It's all HIPAA secure. And then I get that information, then we contact them, and then we set up a video chat. And through our electronic health records, we have a way to do, again, a secure video chat. FaceTime theoretically is not secure, so, people could hack in and all that. So this is a HIPAA secure protected, this ID protected, and then we can have a consultation. I've been offering them for free for people that we had one today for someone that wants to do a procedure, and she's eager to get going, and I'm eager to do it. And we said, okay, let's exchange information. Here are the prices, and we'll get you on the schedule as soon as we can.
That's great, because then, at least they can go ahead and get that initial part knocked out, and then, they have a plan going forward. That, okay, I can have my surgery on this date when things, move forward.
Right.
I have a question. You mentioned testing earlier. Are you planning to test anybody who comes in your office, or just anybody who wants to have a surgical procedure?
I would say probably a surgical procedure, because the thing about that is that the testing, the best scenario, I think they talk about these tests are like 15 minutes or something like that. But if it's going to take a couple of days, you clearly can't test someone that comes into the office. So what I would do is when I see someone, I examine them, and I say, with precautions, say, okay, let's, schedule your breast augmentation. And then it's scheduled for whatever, a month from then. Then in that meantime, we would, try to make sure that, and I think that'd probably be more likely, that there'll be labs that offer it, when they're going to get their blood count and their chemistries, routine screening labs for surgery, that they would then add a COVID-19 test to it. Yeah, I think that's probably reasonable. And you know what? If they have the serologies then, and I think, I don't know what they talk about. This is like interesting. They talk about the prevalence that we're going to have in the United States, and, whether half of us are going to have it at some point, or a quarter of us are going to have it, or a tenth of us are going to have it. I think many, many, many people are going to have it, and thank God that the vast majority are going to have it and do okay. And then if you do okay, that means you have antibodies, and you're probably not likely to get any worse, and you're also not likely to still be carrying it and then spread it to someone else. So.
Do you see this being made to be a mandatory vaccine?
I'm sorry. Do I think? What did you say?
Do you think this will be made to be a mandatory
No,
vaccine
I don't think.
that
Well,
you
first
can't
of
fly?
all, I know we've talked about this, Rhonda. We're going to like a vaccine discussion. I don't think vaccines are ever mandatory. No, I don't. I think they can be highly recommended by health policy experts and then by your own doctor. We talked about this. I mean, certain pediatricians. It's interesting because I was actually looking online yesterday about this, and some people that it's always the same thing. You're going to have people on one side, the other side in terms of fringe and this and that. We have to get back to work. It's a hoax, whatever. So certain doctors, in fact, that are promulgating certain ideas that it's been maybe overhyped and that they're not going to be jumping onto the vaccine so soon. But I mean, I think it's a totally personal decision. I personally am an advocate of vaccination, and so I think that yes, at some point, if a vaccine is available for this thing, I would be very likely to take it myself. But I can't force anyone to take it. No, I don't think that's going to be.
Yeah, I just didn't know if you thought
not the
this
United
something
States.
down the road, the government mandates, or I just heard different.
No, I don't think so. I don't think so
on
either.
it.
This is another interesting. So this tracing thing. I know we're getting right back to COVID-19, but it's hard to escape the topic. So that they in about a week or so they talk about how Google and Apple. I mean, we all carry our phones, right? So Android or Apple.
Mm-hmm.
So your Bluetooth. This is going to be something you have to opt into it, but your Bluetooth is going to send out a little signal. So when you're in the market and there's 6 or 8 people you've come close to in the market, and then if one of you tests positive, you or one of those people, you will be able to get a signal back on your phone saying, hey, you were near someone that tested positive, 2 days ago, 3 days ago, and it's going to give you all kinds of advice. Stay home,
You're kidding
don't
me.
freak out, go get tested. What's that?
You're kidding me.
Oh, you didn't hear about that?
Didn't know. No, I had not.
Well, it's not. It's
Wow.
not going to be mandatory, and it's something that they actually used. That apparently they used it, I think, in Korea, either Korea or China. But the difference in the United States is that they're not going to force anyone to do it. It's just going to be optional. But if we will. Oh, is it almost time to?
Give folks your phone number, real quick. I didn't
What's
mean to
that?
cut you off, but we're running close to time. We have to go, but I want you to give folks your phone number, real quick.
Okay, the phone number is 954-752-1020.
I have enjoyed talking to you tonight, Dr. Levins, and thank you for coming or calling into the show. I will catch you in a month from now, and to everyone out there, stay well, be healthy, stay positive.
Thank you very much, Don. Take care. Have a good night.
Thanks for listening to the Ask the Expert Show, featuring interviews with local experts in the fields of legal, health, financial, and home improvement. Call our office at 888-574-6999 to become one of our experts on the show. And tune in again next week for more Ask the Experts with Steve-O. The opinions expressed on the preceding sponsored program were strictly those of its hosts, guests,